infected at least 400,000 worldwide, and counting. It all started in December last year when cases of an unusual pneumonia were reported in the Chinese city of Wuhan. Most of those affected by the unknown virus seemed to have something in common. They were working at a local seafood market. As the Chinese health authorities were trying to investigate the causes of the illness, the numbers kept growing. On January 7th, the World Health Organization announced it had identified the new virus. 4 days later, 41 people had been diagnosed in China, and the first death was reported. By January 13th, cases in other countries began to appear. And the death toll jumped from tens to hundreds to thousands. In the coming weeks and months, governments worldwide took different measures to stop the coronavirus, but it was too late. On March 11th, the WHO declared the outbreak a pandemic. For many, COVID-19 has changed the world as we know it. From social gatherings, to schools, to airports, from factories to diplomacy, and the media, we've all had to make unprecedented changes to stop this pandemic. I'm Mohammed Jamjoom in Doha. Week after week, Talk to Al Jazeera travels to different locations to sit down with world leaders and decision makers. But this time, the restrictions put in place to ease the effects of the pandemic means we have to stay where we are. So, is the world doing enough to combat this global health crisis? And when will the battle against COVID-19 be won? Find out as the Executive Director of the World Health Organization's Emergencies Program, Dr. Michael Ryan, talks to Al Jazeera. Dr. Mike Ryan, thank you for talking to Al Jazeera. Dr. Ryan, in the past few weeks, I heard you say that you believe that we were in the beginning or possibly the middle of this pandemic. What do you think now? Any predictions on where we might be in all of this and when it might be over?
I actually think predictions are extremely unhelpful at this moment. The epidemic is evolving rapidly all over the world, and there is no accurate way to predict the future in the coming weeks. We have to deal with what we see now, and we have to plan for the situation deteriorating in a number of countries, in which it already has in many. Many countries, though, are not in that situation. Many countries have a low number of cases, and they need to work as hard as they can to contain this virus so that they don't progress into the situation that other countries find themselves in now.
Where do things stand right now when it comes to potential vaccines and treatments?
Vaccines are a long way out at this point, and I want to be clear with and honest with everyone. It's going to take at least a year to bring vaccines into the fight against this virus. There are at least 30 candidate vaccines currently being developed or already under trials. In fact, trials started last week in the United States, and further trials will be starting in China and other countries in the coming weeks. So we have hope in that vaccine candidates are going into trials. But once there's a series of steps, phase 1, 2 and 3 trials that need to be completed, and then we need to be able to scale up, produce and distribute that vaccine to everyone who needs it. That's a massive effort. It's going to require a coordinated public-private partnership to do that. We will get vaccines, but it's going to take time. But in the meantime, there's lots we can do about this virus.
There is a drug called hydroxychloroquine. That's an anti-malaria drug. There's been a lot of talk about it by world leaders and in the news the past couple of weeks because there was a small French study that where the drug showed promise as a potential treatment for coronavirus. The problem now is that because that's out there, there are shortages of this drug in parts of the world. So there are people who need it who can't get the treatment. What's the position of the WHO regarding this particular drug as a potential treatment?
I think you said the two key words there. You said promise and potential. And certainly there are many candidate therapeutics or drugs that are showing some promise or potential. But we need to be exceptionally careful. The studies that have been done so far are small, observational studies. They give hints at what might be useful. And as it happens, we are putting hydroxychloroquine and chloroquine into rapidly designed, large-scale clinical trials across a number of countries. And we need those answers. And we also need to be aware that these drugs are needed for people with other conditions. So it is not advisable for individuals or others to be using precious drugs for which we don't have clear evidence for their use in COVID-19. It's extremely important that we rely on the results that are going to come from trials that will tell us how safe and how effective these drugs are. There are so many different ideas out there, and these ideas are wonderful. And doctors and nurses are trying everything they can to save patients. And during that process, we will come up with promising, interesting opportunities. But it is very important that we ensure that these are safe, effective treatments for COVID-19, and that work is well underway. But again, we must ensure that patients who need those drugs for other conditions can still get them, and that doctors avoid using these drugs unless they're part of observational studies or clinical trials.
Dr. Ryan, let me ask you specifically about the United States, because the WHO has warned that the U.S. is at risk of becoming potentially the next epicenter of the COVID-19 outbreak. At the same time, U.S. President Donald Trump has insisted that the country could be back to work in a matter of weeks. Is rhetoric like that President Trump is using irresponsible?
I think the response of the USA has been ramping up over the last number of weeks, and it's a huge response. It's an all-of-government response, with the states, the private sector, and the federal government now fully enabled and accelerating their response. We all want, I've said this before, lockdowns alone will not work. We have to be able to transition from lockdown into solid public health interventions like case finding, contact tracing, isolation and quarantine. At the moment, we're separating people from people with physical distancing and lockdown measures to restricting movements of individuals. That will dampen the flames of this pandemic, but it will not get rid of the virus. So if you would have watched the US government press briefing, they were very clear. They want to break the problem down state by state. They want to see where they can contain the virus with very strong public health measures, and they're working extremely hard to save lives in the hospital setting. Nobody wants to stay in a situation where populations are locked down. It does social, it does economic damage, and everybody should be seeking an exit strategy from that process. But there is no way out of that until we build the public health interventions, until we have the testing in place, and until we're able to cope with the patients that come to our hospitals. And this is something we're working very, very closely with the United States on, and with many other countries. But again, many countries have not reached that point of having widespread community transmission. In fact, if we look in Africa, if we look at Southeast Asia, if we look in the Eastern Mediterranean regions of our organisation, they represent less than 10% of cases around the world, and less than 10% of all the deaths. Many countries still have the opportunity to avoid having to go into those draconian measures, and can use much more extensive public health measures. We need to build this response from the community up. We need to leverage and mobilise communities in the developing world so they take action, they can be part of the solution. And I believe many, many countries in the world can avoid the worst impacts of this pandemic if they act now, and can avoid the worst of the economic impacts as well.
Well, Dr. Ryan, let me follow up on a point that you're making specifically with regard to Africa, because you've said repeatedly these past few weeks that, because Africa has been on the front lines of dealing with epidemics and responding to epidemics, that they may be in a better position than other countries believe them to be in. But at the same time, you've also said that good governance is the key. How concerned are you about what may play out in Africa?
Many African countries and countries in the Eastern Mediterranean, North Africa and the Middle East have major issues with conflict, with fragility, and weak health systems. So there's no question that the risks to those countries, their people, their health systems and their economies are great. But if you look at the African region, or sub-Saharan Africa, at this moment in time, there are only about 1,300 cases there and only less than 30 deaths. So this pandemic is still at a very early stage in those countries. Africa and many other countries in the Middle East have faced major epidemics, and have been facing them for decades, for years. Ebola, cholera, measles, yellow fever, polio. and have dealt with those epidemics. And it does require good governance. It does require an all-of-government approach, but it also requires leveraging and unleashing the power of communities in these countries to be able to empower them to take action, because in many countries the governmental systems and the governmental architecture is not strong enough to deliver services to everybody at the same time. So we need to empower our communities in developing countries, in fragile states, to be able to take action themselves in surveillance, in community-based surveillance, in community care. The United Nations system stands squarely behind those countries. And today, the Secretary General, Mark Lowcock, and the Director General of WHO, Dr. Tedros, are launching a major humanitarian appeal to support those countries.
Dr. Ryan, in the press briefings you conduct, you've spoken often about vulnerable communities. And so I want to ask you specifically about refugees and migrants. I've reported extensively in the past on refugee-related and migrant-related issues. I've reported extensively on the plight of the Rohingya. I've been many times to those camps in Cox's Bazar, Bangladesh, and I'm hearing repeatedly these past few weeks from refugees in those areas who are terrified about the toll that COVID-19 could take on their population. Refugees in other parts of the world also extremely worried. Is the international community doing enough to protect these vulnerable communities? And if not, what should they be doing?
There's no question that refugee and displaced populations, particularly those living in overcrowded and underserved camps, are at a particular risk for two reasons. One, they live in a confined environment. They live very, very close together, and often in conditions that hygiene and sanitation are difficult to maintain. We've seen how this virus has spread on cruise ships, where people are put together, even in luxury situations. Imagine how fast that disease will spread in a camp where people are pushed together, and where hygiene and sanitation is very difficult to deliver. Second reason I'm concerned, and others, my colleagues, Filippo Grandi at the United Nations High Commission for Refugees and others are very concerned, is that many people living in camp conditions are stressed. Many of them have had conditions themselves. They're living with ill health already, many of them, and there are many, many, many vulnerable children, many of them undernourished or recovering from other infectious diseases. So this is a highly vulnerable population in which this disease could spread extremely quickly. The Interagency Standing Committee of the UN, we've come together under the leadership of Mark Lowcock and issued very specific guidance for how to prepare in these situations. And I know that the UN country teams are working very, very hard all around the world to support governments and support NGOs in providing better services to those populations. But it needs to accelerate, and that is what the humanitarian appeal is about today. We need to accelerate our efforts to protect these highly vulnerable individuals, and by doing that, by giving more space, by giving better services, by improving sanitation and hygiene, we will not only fight COVID-19 in these situations, but offer these people the dignity, the respect and the health that they deserve.
And what about countries where conflicts are taking place, countries like Syria or Yemen? How at risk are the populations there?
Very well, obviously similarly at risk, given their own individual vulnerability, given the collapse and breakdown of health services, and given the difficulty in accessing them when there is an epidemic. We've just spent a year and a half in northern Congo, in the middle of a very contentious conflict zone, trying to eliminate a very serious and devastating outbreak of Ebola. We've lost colleagues, we've lost friends in that fight against Ebola. It is doubly difficult to deliver public health services in situations of conflict. And our Secretary General, Antonio Guterres, announced the other day, and WHO very much supports this position, that the lockdown we need right now is on conflict. We need to reduce conflict. Warring sides need to step aside and allow public health to come to the aid of civilians in these situations.
Dr. Ryan, you mentioned Ebola. Can the lessons learned from fighting Ebola be applied to combating COVID-19?
Yes, I think they can. Obviously, Ebola has only affected relatively small parts of Africa. But many lessons have been learned in those responses, and the responses to cholera, yellow fever, Lassa, and other diseases. But specifically in Ebola. Ebola outbreaks may be contained by outside support, or we support the containment of disease from outside. The main way in which Ebola is contained is communities. Communities knowing what the disease is, knowing how to stop its spread, knowing how to participate in surveillance, participate in public health measures, and being supported by the national and international community. At the height of the Ebola outbreak in Congo, in 2 provinces, we were tracking and tracing and visiting 25,000 contacts every day in the middle of what was effectively a shooting war. So it is possible to carry out large-scale public health interventions, even in the most extreme of circumstances. And we need public health authorities all around the world to pick up that flag and move. Surveillance, contact tracing, isolation and quarantine. These are the central tenets of containment. The measures like physical distancing, measures like lockdowns, movement restrictions are useful. They dampen the flames, but they do not get rid of the virus. And this is what we need to do. Have a comprehensive strategy with all of these actions taking place, breaking the problem down. A country like the Democratic Republic of Congo or Nigeria, Ethiopia, very large countries, you can't deal with the problem the same way in each of the different provinces. The situation may be very different in each of the different provinces. So we need to break the problem down, empower communities, go after the virus. The international community, through the United Nations system, will provide every assistance to countries in doing that. I know the World Bank and others have released large amounts of funding to support countries in their national action plans. 90% of countries around the world now have integrated national action plans for the control of COVID-19. We need to support those plans. We need to fund those plans. We need to send surge support to help countries implement. And please, the world can be assured of WHO and the United Nations' absolute commitment to support countries in this.
Dr. Ryan, I want to move for a moment to talking about the current epicenter of the pandemic, Italy. I was in northern Italy in late February reporting on the COVID-19 outbreak. Many of the people that I spoke to there, they were extremely worried about the toll that it would take on the economy, but at the same time, they did not believe that things would get as bad as they have currently gotten. So I want to ask you, what factors are at play there that things have gotten so bad in Italy?
I think there are a number of. I think everyone has been taken aback at the acceleration in Italy and the death toll. But similar situations are emerging in countries like Spain, France, the UK, and many others around Europe. And what we're seeing is health systems and public health systems under extreme strain. But we're also seeing hugely courageous health workers, our heroes, people in the front line, saving lives every day, helping their communities. And we want to shout out and call out to our colleagues in the front line. I've been in that situation. It is tiring, it is stressful, it is frightening, but it is a job these people do with great honour. Europe got a little caught behind the curve. I think everybody around the world was assuming this would be easier to deal with than it was. They made some assumptions around this disease being like influenza, which it's not. And many countries have had to play a good degree of catch-up. But again, I think the Italian government are demonstrating that. They're demonstrating great leadership. They're fighting hard, and they're saving lives. But the situation is tough. It's overwhelming, and our thoughts and prayers are with our colleagues in Italy today.
Dr. Ryan, because you mentioned specifically health workers and the challenges they're facing, let's talk for a moment about that, especially in Spain, where many have gotten sick and many have died. What's being done to protect health workers in Europe and other parts of the world as well?
Well, all governments around the world are scrambling to both train health workers, provide them with a safe environment to work, because it's not just about having protective equipment. You have to work in an environment that's not so overcrowded that it becomes risky that you transfer infection to yourself or to others. So there's been a real push to expand hospital beds, to increase the number of intensive care beds available, to increase the number of beds that can provide critical care. And you've seen that through ventilation and ventilators moving and being delivered all in many countries. But a major issue has been the provision of personal protective equipment to health workers. There's been a market failure at global level. There is a massive undersupply, there is underproduction, and distributing those protective equipment, gowns, gloves, masks, respirators to health workers around the world is a difficult task. We've been working very, very hard with the public and the private sector in the pandemic supply chain network, bringing together the UN system with many private suppliers to try and be a provider of last resort to countries who are struggling to find such equipment on their national or international markets. We thank many companies and governments who are really working to supply us with extra material. Our warehouses in Dubai were practically empty, but now are being resupplied from China, which is fantastic. But again, WHO can only, in this sense, be a provider of last resort. We can fill gaps, we can provide emergency support, but this problem has to be solved at the political level between countries. It has to be solved by the private sector, in avoiding hoarding and gouging and price rises. And we've got to make sure that we rationalise the use of this equipment so that frontline health workers are the ones that are getting this equipment and using it. So there's a lot to do, and I hope global leaders can come together and find a way to ensure that all health workers around the world get the protection that they need as they serve us and save the lives of our friends, our families and our communities.
Dr. Ryan, there's a lot of conspiracy theories out there right now, especially due to the rivalry between the U.S. and China. Has the WHO been asked to investigate claims that COVID-19 was man-made?
No, we've not been specifically requested to do that, but what I can assure you is we've been tracking the genetics on this virus since the very beginning. We've had scientists around the world looking at this virus. We've had all the sequences that are being posted on public websites with our support, and there is no evidence whatsoever at the moment that this is anything other than a virus that's emerged from nature. We tend to look for these explanations in situations when we've such a horrific event. But the reality is, and this has always been the reality, is that we human beings have behaved in a way over the last number of years. We've globalized the planet. And with that globalization have become some benefits in terms of freedom of movement, in terms of economy. But we have stressed the environment. We have invaded the animal-human interface. We have allowed diseases to cross into humans, and when those diseases do cross from animals to humans, those diseases can amplify in poorly equipped health facilities. They can amplify in peri-urban slums. They can amplify amongst stressed refugee populations, and then they can spread because we are connected globally. So the problem we have right now is man-made. The problem we have right now is that we have left ourselves vulnerable to emerging diseases. The diseases themselves are entirely natural, but the situation in which these diseases are spreading are because we, human beings, have created the conditions in which these diseases can spread and cause, as you've seen, tremendous damage to our health systems, to our economies, to our social systems, and most importantly, deaths amongst those we love.
Dr. Ryan, are you getting the sense that people are changing as a result of this and that populations around the world will be changed as a result of this, that they will start to have a different outlook when it comes to all of this?
I think we're all of us are still coming to terms with this event, and everybody has something to do. Everybody's got a job. I've got a job. Every single member of every single community has a job. You've got to protect others. You've got to protect yourself. You've got to protect your community. You've got to contribute. You've got to do what you can to stop this disease. And when this is done, we all need to sit down and see what sort of society we want to have in future. One that's prepared, one that's ready, one that's equipped with the supplies it needs, and one that's willing to invest in the sort of defence we need as a population. Are we to be defended from foreign armies? Are we to be defended from viruses. Where are we putting our investments in society? Where are we placing our major investments in the protection of our society, our civilization, and our way of life? That's a conversation for later, but it's a conversation that can begin now. But now we have to fight.
Dr. Ryan, thank you for talking to Al Jazeera.